Hello all. In today's video, I'm going to tell you about seed cycling or seed rotation. Menstrual dysfunctions are a group of acute difficulties that women suffer around the world during their reproductive years and for a few years beyond menopause. And they have a significant impact on women's daily life. The higher prevalence of hormonal imbalance in women is a contributing factor to all of these menstrual dysfunction. The major hormones that control menstruation in females include progesterone, estrogen, luteinizing hormone, and follicular stimulating hormone. And a simple imbalance in their concentration is the root cause of a variety of menstrual problems. The practice of eating specific seeds during the two main phases of the menstrual cycle, that is, follicular phase and luteal phase, to promote a healthy balance of estrogen and progesterone levels in women is known as the seed cycling or seed rotation diet. Seed cycling is developing diet trend that has been claimed to improve hormonal balance, fertility, and menstrual health dysfunction in women of reproductive age and those approaching menopause. It mostly entails the ingestion of seeds such as flaxseed, pumpkin seed, sesame seed, and sunflower seed at various points throughout the month to regulate hormones that regulate female menstruation health. So, how to get started? How to start eating these seeds? How does seed cycling occur? Let us assume that a menstrual cycle is for 28 days for an average female. It looks something like this. That is day 1 to 14. That is follicular phase. So 1 to 14 is follicular phase. During that phase, follicular phase, one has to consume 1 tablespoon ground flax seeds and 1 tablespoon pumpkin seeds. So, like next is assume that ovulation is happening or happened. That is so during the 14 to 16 day, and there will be ovulation. And next comes day 15 to 28, luteal phase. That is the second phase, 15 to 28 days, is luteal phase. We have to consume 1 tablespoon sesame seeds and 1 tablespoon sunflower seeds. Then comes the periods. So this is how we have to consume the seeds during our during. You can see the diagrammatic representation. So from day 1, that is the first day of our periods, the estrogen hormone boosts. The level of the hormone boosts. It is the follicular phase during which we have to consume 1 tablespoon flaxseed daily and 1 tablespoon pumpkin seed daily. Then on the day 14, we have to stop it, and from 15th day to the 28th day, that is luteal phase, we have to consume sunflower seeds and sesame seeds to increase the level of progesterone hormone. So here the estrogen level should decrease and the progesterone level should increase for the periods to come on the 28th day. This is how seed cycling should be done for hormonal balance. And these seeds, flaxseed, pumpkin seeds, like if you are making it into powder, it should be used, a fresh powder should be used. That is on the day of consuming these pumpkin seeds, you have to crush the seeds and use it as a powder. You can't use like a pre-stored or packed pumpkin seed powder or flaxseed powder. You have to powder it on the day of consumption. This is very important. Let us see the role of each seed in its menstrual function. The pumpkin seeds contain a higher percentage of phytoestrogens, minerals, zinc, magnesium, copper, manganese, ferrous, and phosphorus, and steroids. Phytogens are present in pumpkin seeds at a concentration of 265 milligram per 100 gram of seeds. They mimic estrogen function due to their ability to bind the estrogen receptors. So the estrogen level should be high during the first phase of the menstrual cycle. Hence, we are consuming pumpkin seeds, which increases the level of estrogen. Next comes the zinc. It supports progesterone production towards the second phase of the menstrual cycle. That is, the progesterone level gradually increases and it comes to the peak after 15 days. Zinc promotes the formation of corpus luteum, which is responsible for producing progesterone and stimulates the uterus to thicken in preparation for potential implantation. Next comes the role of flaxseed. Flaxseed helps in lengthening the luteal phase, improving ovulation, and reducing common premenopausal symptoms such as mastalgia, that is cyclic breast pain, and cramping. Flaxseed consumption can cure menstrual irregularity due to the presence of lignin. Lignin is a type of fiber. Next comes flax seeds are rich in alpha-linolenic acid. They provide a host of other nutrients, including manganese and magnesium. Flax seeds improve menstrual regularity and increase progesterone secretion due to the presence of omega-3 fatty acid. Sunflower seed and its role in menstrual function. Sunflower seed and sesame seed should be consumed during the second phase, that is luteal phase. Sunflower seeds are a rich source of vitamin E and minerals like calcium, iron, magnesium, phosphorus, potassium, sodium, zinc, copper, manganese, and selenium. Out of these important constituents, the principal nutrients that are crucial for menstrual health in seed cycling diet are vitamin E and selenium. The trace mineral supports estrogen detoxification in the liver, which helps bind excess estrogen during the luteal phase when estrogen declines and the progesterone level rises. Sesame seeds and its role in menstrual function. Sesame seed is a good source of omega-3, omega-6 and vitamin E and is recommended in the seed cycling diet. Due to the presence of these nutrients, sesame seed is believed to improve hormone production and follicle function. The higher the concentration of zinc in pumpkin seed improves the formation of corpus luteum in the uterus, which is responsible for producing progesterone and stimulates the uterus to thicken in preparation for potential implantation. Sesame also contains lignans, which help to block excess estrogen during the luteal phase. Now coming to polycystic ovarian syndrome and seed cycling diet. Polycystic ovarian syndrome is a complicated disease characterized by interconnected genetic, endocrine, environmental, and behavioral variables that result in different reproductive, metabolic, and psychological characteristics. Irregularity and long menstruation cycles are believed to be the hallmark of the syndrome. Endocrine factors for PCOS include follicle stimulating hormone deficiency and hypersecretion of luteinizing hormone and hyperandrogenemia. That is the increased secretion of androgen hormone. Androgen is a male hormone. Seed cycling is effective in correcting hormonal imbalances and improving menstrual problems, which can serve as a base for positive effect on PCOS management and prevention. Seed cycling takes an average of 3 to 4 months to achieve the intended effect of an ideal hormone balance as well as improved intestinal absorption. So you have to consistently follow the diet and you cannot expect the results immediately after a month. Seed cycling is beneficial to everyone regardless of gender, and provides a wide range of benefits. Some of the conditions it may be particularly helpful for include PMS, PCOS, premenopausal syndrome, acne, irregular cycles, abnormal bleeding, low libido, or depression associated with postmenopausal hormonal changes. Seed cycling has gained popularity and acceptance among some consumers as a natural method to regulate hormones and address menstrual cycle related issues. The easiest way to eat the seeds is to incorporate it in smoothies, salads, soups, sprinkled on oatmeal, and added to vegetables or grains. It can also be included in our homemade energy balls. Thanks for watching.